Hi, everyone. My name is student Dr. Kristen McPherson, and I am an MS2 on the Cherokee Nation campus. I'm representing myself and my colleagues today, and I will be presenting our research over person-centered language and HIV research. This was a cross-sectional study of stigmatizing terminology in medical literature, specifically as it relates to HIV. So first off, I wanted to start by giving a little bit of background on the prevalence of HIV. So in 2020, approximately 38 million people worldwide were living with HIV, and 1.5 million people newly acquired HIV. 680,000 people died from it. Individuals living with HIV frequently experience various forms of stigma, which can lead to many detrimental biological, psychological, and behavioral outcomes. And reducing HIV-related stigma has the potential to lead to improvements in screening and diagnosis, HIV-related outcomes, as well as quality of life for people living with HIV. One way to reduce this societal stigma is to be intentional about the language we use, especially within medicine and medical research. In order to avoid labeling an individual or group, it is important to use person-centered language, or PCL. Briefly, PCL places the person first and avoids defining an individual by their illness or their disease. But despite many initiatives and guidelines, stigmatizing language has been shown to be prevalent in some areas of medical research, as well as among medical professionals. Poor awareness of PCL and its importance leads to persistent use by medical professionals, which contributes to stigma and its impact on quality healthcare. However, evidence of adherence to person-centered language in HIV literature is lacking, which is why the objective of this study was to quantify the use of person-centered language in research journals that publish high volumes of HIV-related manuscripts. So how we conducted our study, we searched PubMed for HIV-related articles published between January 1st, 2017 and March 7th, 2021. After journal reduction and article randomization, title and abstract screening was conducted among 500 studies in a masked duplicate fashion. Studies were systematically searched for pre-specified stigmatizing terms, partial terms, and phrases, and prevalence rates of non-person-centered terminology were totaled, and the total number of articles adherent to PCL guidelines were reported. Statistical tests were used to determine associations between PCL adherence and article funding source, type of article, type of research, among other variables. So the results of our study, we found that among 239 studies included, only 21% or 51 articles of these HIV-related publications were found to be PCL adherent. Stigmatizing labels such as HIV or AIDS infected and HIV or AIDS person or patient were used most frequently, with HIV or AIDS infected appearing in 57% of articles and HIV or AIDS person or patient appearing in 31% of articles. And that's displayed here, as well as some of the other terminology we searched for among these publications. So despite numerous guidelines and requirements for the use of person-centered language in research, our findings suggest that an alarming number of HIV-related articles are not following these guidelines. This is concerning because labeling likely contributes to the persistence of stigma in HIV-centered care. So in conclusion, our study serves to raise awareness of stigmatizing language in HIV literature and to challenge the medical community to raise the bar by reducing the use of stigmatizing terminology in HIV literature and replacing it with clinically accurate PCL. The biggest takeaway from this study is that the intentional use of person-centered language in medical research has the potential to minimize the use of stigmatizing language amongst medical professionals in medical education and medical records and patient encounters. And reducing this stigma experienced by people living with HIV may help support a higher quality of care and foster positive healthcare outcomes. So these are our references. And here is our contact information if anyone has questions or comments. I appreciate your time and thank you for listening, and please don't hesitate to reach out, and have a wonderful day.